Our bodies hold secrets. Deep within us, processes unfold silently, for good or for ill. And one of the greatest challenges in medicine and in life is that so many of the most dangerous conditions, like a stroke, can develop for years without a single obvious warning sign. We check our blood pressure, we monitor our cholesterol, but we are often looking at indirect clues. But what if I told you there was a place in your body where the secrets are revealed? A place where a doctor could look, non-invasively, and see the health of your brain's delicate plumbing in real time. What if there was a painless, routine procedure that takes a secret photograph of your stroke risk, years before a crisis could ever occur? There is. And it's a procedure millions of us undergo every single year, thinking it's for a completely different reason. Let's consider a common story. A gentleman in his 70s, diligent about his health, undergoes a very routine checkup. It's a simple process. He sits in a dark room. He looks at some lights. The doctor tells him that he sees a few minor changes, consistent with his age, but that everything looks generally stable. The man is relieved. He has completed another small task on his health checklist. Several months later, he collapses. He suffers a major stroke that changes his life and the lives of his family forever. And everyone is left asking the same heartbreaking question. How? We had no idea. He just had a checkup. How could we have missed it? The tragedy is that they didn't miss it. The warning sign was there. The secret photograph of his brain's failing blood vessels had been taken. The problem was, its true meaning, its profound implication for his entire body, was not fully appreciated or communicated. The dots were never connected. What is this hidden window? This secret photograph of your brain's health? It's your annual eye exam. Yes, that simple, humble ritual of checking your vision is the subject of our conversation today. And we are going to explore the critical, life-saving link between the health of the tiny blood vessels in your eyes and your personal risk for a stroke. It might be difficult to hear that a procedure you've always trusted could hold such critical, overlooked information. It can be unsettling. But my purpose here is not to create anxiety. It is to illuminate a hidden truth, to replace broad generalizations with the precision your health deserves. This is about empowering you with a new and profound understanding of your own body, so you can become an active, informed partner in your own wellness, not just a passive follower of old routines. This conversation will forever change how you view that yearly appointment. So please, stay with me, because by the end of our time together, you will understand the remarkable connection between your eyes and your brain. You will know what those age-related changes really signify, and you will be equipped with a specific list of powerful, life-saving questions to ask your doctor. Questions that will ensure this vital window into your health is never, ever overlooked again. Let's begin this journey of discovery. It starts with that incredibly familiar routine, the annual eye exam. It is a cornerstone of responsible healthcare as we age. We schedule it dutifully. We sit in the chair and we follow the instructions. Place your chin here. Look straight ahead. Don't blink. A bright light is shone into our eyes as a doctor peers through a lens. We read the letters from the chart, trying our best to get them right. They check the pressure inside our eyes, sometimes with that startling but harmless puff of air. And then comes the part that is most crucial to our conversation today: the dilated exam. A technician or doctor will administer eye drops that widen your pupils. They'll tell you your vision might be a bit blurry and you'll be sensitive to bright light for a few hours. Why do they do this? They do it to get a clear, unobstructed view of the very back of your eye, the retina. They are looking for common age-related eye diseases: glaucoma, which damages the optic nerve; macular degeneration, which affects your central vision; and cataracts, the clouding of the lens. And of course, the primary goal for most people is to determine a new, more accurate prescription for their eyeglasses. The entire experience, from beginning to end, is framed around your vision. The outcome is a new pair of glasses. The conversations are about how well you can see. If the doctor does mention the health of the retina itself, the language is often minimized to avoid causing undue alarm. They might say something like, "The blood vessels show a few signs of wear and tear, which is quite normal for your age." Or, if they know you have high blood pressure, they might say, "I can see some effects of your blood pressure on the arteries, so it's good you're on medication for that." And with that, you are sent on your way. You pick out new frames, perhaps feeling a little frustrated at the cost, but relieved that your eye health is stable for another year. You trust that you have done the right thing. You believe you have had your eyes checked. You have absolutely no reason to suspect that you have just undergone one of the most powerful predictive screenings for brain health available to modern medicine. This is the knowledge gap that is having tragic consequences. The routine itself isn't the problem. It's a blessing. The problem is our routine understanding of it. The problem is the systemic failure to communicate the profound importance of what can be seen in the back of the eye. The trust you have in your eye doctor is well placed, but that trust must now be fortified with a new understanding of what you should be asking them and what their findings truly mean for your entire body. So, let's explore the astonishing science of the eye-brain connection. Why is a simple look at your retina a direct look at your brain? The link is not a theory. It is a fundamental fact of human anatomy and embryology. When a human being is first developing in the womb, the brain forms as a primary structure. In a remarkable process, a part of what will become the forebrain literally grows outward on two stalks, which will become the optic nerves. The tips of these stalks then form the retinas. Your retina, the light-sensitive tissue that lines the inside back of your eye, is not just connected to the brain. It is brain tissue. It is a part of your central nervous system that has been uniquely externalized, placed in a position where we can see it. This makes the eye an unparalleled window into the body. It is the only place we can directly visualize a person's microvasculature, their smallest blood vessels, arteries, veins, and capillaries, in their natural, living state, without making a single incision. When your ophthalmologist or optometrist looks into your dilated eye, they are seeing a live, high-definition broadcast of your vascular health. And here is the most critical piece of the puzzle. The tiny blood vessels that crisscross your retina share the exact same characteristics as the tiny blood vessels that penetrate deep into the tissues of your brain. They are of a similar size, they have a similar structure, and they respond to disease in the same way. They are subjected to the exact same pressures from your heartbeat, the same levels of sugar from your diet, and the same inflammatory chemicals circulating in your blood. Therefore, the condition of the blood vessels in your retina is a direct, real-time proxy for the condition of the blood vessels in your brain. What happens in the eye is a preview of what is happening or is about to happen in the brain. The term for disease or damage to these retinal vessels is retinopathy. When your doctor sees signs of retinopathy, they are seeing the warning signs of a potential stroke. Let's break down exactly what they might see and translate it from medical jargon into plain English. One of the earliest signs is generalized arteriolar narrowing. This means the arteries in the retina are becoming thinner. High blood pressure forces the muscular walls of the arteries to constrict. Over time, they can become permanently narrowed. If your retinal arteries are constricting, you can be certain that the arteries in your brain are doing the same thing, reducing the vital flow of blood and oxygen. A more advanced and very specific sign is arteriovenous, AV nicking. This is a powerful predictor of stroke risk. It happens where a small artery crosses over a small vein. A healthy artery is soft and flexible, but an artery that has been hardened by years of high blood pressure becomes stiff, like a dry twig. When this hardened artery presses down on the softer vein beneath it, it compresses the vein, causing it to bulge on either side. It looks like someone is stepping on a garden hose. This is a clear, unmistakable sign of advanced arteriosclerosis or hardening of the arteries. Your doctor might also see microaneurysms, which are tiny, fragile bubbles bulging out from the walls of the capillaries. These are weak spots that are prone to leaking or bursting, or they might see the result of that leaking. Hemorrhages. These are small bleeds on the retina. They can look like little red dots or like tiny flames. Seeing these means that your smallest blood vessels have become so fragile that they are breaking under pressure. This signals a profoundly increased risk for a hemorrhagic stroke in the brain. Finally, and perhaps most ominously, the doctor may see cotton wool spots. These are small, white, fluffy-looking patches on the retinal surface. Each one of those spots represents an eye stroke. It is an area of nerve tissue that has died because its tiny blood supply was blocked by a microscopic clot or plaque. If you are having mini strokes in your eye, it is a 5-alarm fire bell, warning you that your entire vascular system is in a state where it is actively forming blockages. A major stroke in the brain could be imminent. The connection is undeniable. What the eye doctor sees is a direct reflection of your brain's reality. Retinal narrowing predicts cerebral artery narrowing. A V nicking proves widespread arterial hardening. Retinal hemorrhages signal a brain that is at risk of bleeding. And cotton wool spots are evidence of an ongoing stroke process. The danger then is not the exam. The danger is silence. The danger is a lack of translation. It's the danger of these critical findings being noted in a chart, but not being communicated to you, the patient, with the gravity they deserve. It's the danger of that information not being shared with the rest of your medical team who are managing your blood pressure and your overall health. Now, given the seriousness of these findings, who needs to be the most concerned and proactive? While this knowledge is a game changer for every person over 60, certain groups must treat their dilated eye exam as one of the most important medical events of their year. At the very top of the list are individuals with high blood pressure. If you have hypertension, your eye exam is no longer optional. It is essential. It is a direct report card on whether your treatment is truly protecting your brain. Many people feel fine on their blood pressure medication, but the eye exam can reveal that the pressure is still high enough to be causing silent, progressive damage. Next, of course, are people with diabetes or prediabetes. The term diabetic retinopathy is well known, but it's often thought of as just an eye complication. That is a dangerous misconception. It should be thought of as diabetic systemic vascular disease that is visible in the eye. What you see in the eye is happening throughout the body. Anyone with a known history of high cholesterol, atherosclerosis, or carotid artery disease must also be highly vigilant. The eye provides a direct look at how plaque and hardening are affecting the smallest, most vulnerable vessels, which are often the first to show damage. Smokers need to understand that every cigarette directly poisons the delicate endothelial lining of their blood vessels. The retina will often show the devastating effects of this long before a catastrophic event like a heart attack or stroke occurs. And frankly, given that age itself is a primary risk factor for vascular disease, every single person over the age of 65 should adopt this new mindset. Viewing your annual eye exam as a preventative brain scan is one of the smartest, most powerful things you can do for your long-term health. Now that we have established this powerful and perhaps surprising connection between the eye and the brain, I'd like to pause and ask for your insight. Your collective experience is valuable. In the comments below, please take a moment to answer this question. Drop a 1 if you've ever been told by an eye doctor that you have changes or narrow arteries in the back of your eyes, but you never fully understood the connection to your overall stroke risk. Drop a 0 if this concept of the eye exam as a window to the brain is new information for you. Thank you for sharing. Your answers help illuminate how important it is to bridge this communication gap. And now, we will dedicate the rest of our time together to building that bridge. Let's move into the solutions. How do we take this powerful knowledge and translate it into practical, life-saving action? The goal is not to avoid eye exams. It's to elevate them. It's to ensure they fulfill their highest potential as a preventative health screening. First, it can be helpful to understand the professionals you are seeing. An optometrist, OD, is a doctor of optometry and your primary source for vision care. They are experts at prescribing glasses and detecting a wide range of eye diseases. An ophthalmologist, MD, is a medical doctor who specialized in ophthalmology. They do everything an optometrist does, but they also perform eye surgery. If you are in a high-risk group, especially if you have multiple conditions like hypertension and diabetes, it may be beneficial to have your annual dilated exam performed by an ophthalmologist, as they are often more deeply engaged in managing the systemic and surgical aspects of eye disease. Second, you must take control of the pre-exam conversation. Don't be a passive patient. When you sit down, set the stage. You can say, "Doctor, in addition to my vision, I am very focused on my cardiovascular health and stroke prevention. I understand the retina can provide important clues. I would be grateful if you would share your detailed observations about my blood vessels with me today." This simple statement immediately changes the dynamic and signals that you expect a deeper level of conversation. Third, and most importantly, you must be ready with your post-exam questions. Don't be intimidated. Your future health could depend on it. Have them written on a piece of paper. Question 1. Now that you have examined my retina, can you please describe the health of my blood vessels in detail? Are they showing any signs of damage from my blood pressure or age? Question 2. Specifically, did you observe any arteriolar narrowing, any AV nicking, any microaneurysms, or any signs of bleeding? Using these terms shows that you are an informed patient. Question 3. If you have a digital image of my retina, would you be willing to put it on the screen and show me what you are seeing? This is a powerful educational tool. Seeing your own retinal artery compressing a vein makes the risk tangible. Question 4. This is the most important question. Based on what you see in my eyes today, what is your assessment of my systemic vascular risk? And should this information be communicated to my primary care doctor? Question 5. The action step. Thank you. I would like to make sure that happens. Can you please ensure that a copy of my full report with your specific retinal findings is sent to Dr. E, your primary doctor's name? This final step, ensuring a triangle of communication between you, your eye doctor, and your primary physician or cardiologist, is the ultimate solution. A finding of hypertensive retinopathy that stays isolated in the eye doctor's file does nothing to prevent a stroke. But that same report, when it lands on the desk of your primary doctor, becomes a powerful catalyst for action. It might be the reason they adjust your blood pressure medication. It might prompt them to order further testing. It closes the loop and turns a passive observation into active prevention. As we conclude our discussion today, I want you to reflect on the paradigm shift we have just made. A routine chore, the annual eye exam, has been transformed in your mind. It is no longer just about seeing clearly. It is about seeing the future. It is about seizing one of the most remarkable opportunities in all of medicine to peek inside your own body and take action before a crisis ever has a chance to develop. This knowledge should not bring you anxiety. It should bring you a profound sense of agency. The early warnings of a stroke are not always silent. They are often written in the beautiful, delicate script of the blood vessels in your eyes, waiting for an informed person like you to ask the right questions and demand a translation. Let's summarize this new, empowered approach in 3 guiding principles. First, reframe your eye exam. It is no longer just an eye exam. It is a non-invasive brain and vascular health screening. Treat it with the focus and seriousness it deserves. Second, become an active investigator. You are no longer a passive patient. You are a partner. Use the specific questions we have discussed to investigate the health of your own retinal blood vessels. Third, be the communicator. You are the advocate for your own health. It is your responsibility to ensure that the vital information from your eye exam is shared with your entire medical team so that it can be acted upon. You have the power to turn this simple, routine appointment into one of the most powerful preventative tools you possess. It is an incredible opportunity to safeguard your mind, your health, and your precious independence for all the years to come. Thank you for your time and for your willingness to look at this familiar routine in a new, more powerful light. Please share in the comments what part of this eye-brain connection was most surprising or meaningful to you. Your insights help us all. And if this is the kind of deep, truth-based health knowledge you value, I warmly invite you to subscribe to Health Signal and join our community of informed health advocates. Be well, be wise, and see your health more clearly than ever before.